You talked a little bit about performance in athletes, and we've touched earlier on how your nutritional needs cycle with your menstrual cycle. And so for all the female athletes listening, starting with just like a food first, not supplements kind of approach, what are the things I should be thinking about eating more or less of during the follicular versus luteal phases of my menstrual cycle?
So this area is so fascinating. You know what I'm going to say? There's scant research when it comes to this particular space, but growing. I've seen it integrated into some, like sports nutrition sports dietitians, what they're doing with female athletes, and it's really interesting. So I'm sure you guys have covered this a million times, but a typical menstrual cycle textbook is 28 days. And the first half of the cycle is your follicular phase, and the second half is the luteal phase with ovulation in between. And during that time, in the first phase, estrogen and progesterone are low, and then estrogen rises just before ovulation and peaks. And then in that second phase, estrogen and progesterone both rise and peak mid-luteal phase. The reason I mention that is because estrogen and progesterone both drive different nutritional needs and requirements, and also gut symptoms across the cycle. So typically we find in that kind of early follicular phase, so during the bleeding phase when hormones are low, nutrient requirements aren't specific per se, but you might find because of all the prostaglandins, those inflammatory markers, that actually your gut is a little bit off. People find that they get really loose stools during that time. And so paying special attention to things like maybe you're not having too much caffeine, spicy food, even like sugar-free foods or chewing gums that can produce a lot of gas and can make those symptoms worse. And if you are an athlete, thinking about hydrating more as well during that time. Because we're losing iron, we want to think about replenishing that iron, getting some vitamin C in there because it helps with iron absorption. So, like bell peppers, citrus foods. Then as estrogen rises, we often find that appetite decreases. And so people will naturally find that they're maybe eating less or their cravings are a little bit under control. Estrogen really helps with insulin sensitivity. So it helps keep our energy levels stable.
Would increased insulin sensitivity mean that you could handle carbs better?
Yeah, absolutely. Whereas the opposite's true in the luteal phase. And we have this change in kind of utilization of nutrients. So what we find is we become less insulin sensitive in that luteal phase when progesterone's high. Cravings are higher, food intakes in higher, and also we have an increase in our metabolic rate, so how much energy we're burning at rest. And this will vary from woman to woman, but some studies estimate up to 300 calories extra per day.
Your body is going to tell you to consume less because cravings are lower, but your sort of resting metabolic rate is actually 300 calories higher.
This is in the luteal phase. So you actually will crave more and you'll eat more.
You crave more.
So because your metabolic rate is high, your body is very intuitive and it starts telling you we need to eat more food. So naturally we see an increase in food intake. So we see cravings increase, metabolic rate increases, and food intake increases.
So that's interesting. So you're saying that in the luteal phase, that second half of your cycle, I'm going to be hungrier, but my body needs more. So it's okay to give in to those cravings.
Yes. The follow-up question I often get for this is, so I need to eat 300 calories extra per day in the luteal phase. And it's not that prescriptive. I don't want women to go back and start tracking that. But if you are finding that you're more hungry in that phase, which most women are, I want you to really double down on your nutrition. So if you find your cravings are out of control, we need to think about, are you having regular meal times? Are you making time for snacks? Are those meals balanced in carbohydrates, fat, and protein? And because you're less insulin sensitive, we need to be even more kind of careful about what carbohydrates we're having. Are they high in fiber? And if we pair them with a protein and a fat, so say you have sourdough toast and you have avocado and then an egg, that is a balanced meal, and it means it stabilizes that glucose response. So you feel, fuller for longer, but your energy is more stable. You're less likely to have cravings and you're less likely to be moody or cranky. So there's some benefits there from a PMS perspective.
That's interesting. So the moody crankiness, which is a sign of often low blood sugar because you're is actually a metabolic health symptom, and therefore you could manage those kind of moody, cranky PMS symptoms simply by increasing fat and protein and decreasing carbs?
Probably a bit of both for most people. So I think for anyone who finds that their mood changes premenstrually, you get a bit more irritable or tearful. It's really important to think about your nutrition during that time. It's not a time to be skipping meals. It's not a time to be surviving off caffeine. None of that's going to make you feel good. It's okay if you do want ice cream and chocolate to make you feel good. I think comfort eating isn't inherently bad, but if it becomes our tool, our coping mechanism, then it can be problematic. But PMS is interesting because that exists on a spectrum, and 90% of women report premenstrual symptoms. And then a smaller group, but still quite large, 20 to 40% of women have diagnostic premenstrual syndrome, where it impacts their day-to-day. And then a smaller group have something called PMDD, or premenstrual dysphoric disorder, which is very severe PMS with more marked mood symptoms. You know, there's emerging research that certain nutrient deficiencies can exacerbate PMS and PMDD. And so by correcting these, we might be able to help mitigate some of those symptoms. Not completely cure PMS or PMDD, I'm not suggesting that, but help with symptoms.
And what are those nutrient deficiencies?
Calcium and vitamin D are two big nutrients. Magnesium is another important one. And thinking about things like, as we mentioned, meal timing and having balanced meals so that we're stabilizing our energy levels. We're basically trying to keep really balanced homeostasis in our body so that we feel at our best. Because around nutrition, if you are someone in one of those buckets, I want you to be thinking about doubling down on your sleep, moving your body, even if you don't feel like it, it's going to help with your symptoms, and thinking about giving yourself time for stress management and maybe creating more boundaries around things like social occasions. If you know that during that time, your body just needs to rest more, and you'll probably see it in your data. I know I do in mine, like that premenstrual week for me, my HRV is always so low. My heart rate has creeped upwards, but because I have that knowledge now from tracking for so long, I don't panic. I know what my body needs, and I know it's going to recover the next week. It just pings back up come day one of my cycle. It's so funny because even in the morning when both my partner and I will look at our Whoop scores, and if mine's like progressively getting lower, he'll say, "Are you in your luteal phase?" Like he knows now like what it means for me, and I just know what my requirements are. So I guess like bringing that back together, I think when it comes to women, I don't want you to think that there's something wrong with you if you're having symptoms or you're having changes in your HRV or heart rate, or you've got different requirements to a male partner or a male friend. It's just different. And it's about learning those differences and seeing what works for you. And I think if more women had that knowledge or were given that knowledge, then they would find that their menstrual cycles wouldn't be as turbulent, and they'd probably find that they can continue to train throughout their cycles and also feel really optimal and feel better than they do. But right now, we just don't cater for women at any point of their lifespan.